Hello, everyone. Welcome to LUMP Auricular Medicine class. Today we shall discuss the points of helix and Crus of Helix and the points of Antitragus and the Intertragic notch area. First, the 9 points of the helix and Crus of Helix are the assorted points and points of the lower body. So we have from points 56 to 64. '56 is the diaphragm point. This is located near the lateral edge of the crus of the helix. 57 is the lower portion of the rectum. This is located at the helix, roughly parallel to the large intestine point. 58 is hemorrhoids point, border of helix parallel to the uterus or prostate point. If you remember, the prostate point or the uterus point is located at the triangular fossa in this area. 59 is the common cold point. It is located at the border of the helix, parallel to the hypertension point at the triangular fossa. 60 is ear apex. It is located at the apex of the helix of the ear, and this is found by gently folding the helix, sometimes called urchion. Then we have points 61 to 64 are helices 1 to 4. This is found by dividing the helix horizontally into 6 equal parts. Helices 5 and 6 have already been numbered as point 17 and 19, discussed under the low points. The first point is on the helix, parallel to the tubercle of the helix. The sixth point is found in sector 8 of the lobe. All of the others are found in between those divisions at equal intervals. So again, 56 is diaphragm point. This is located near the lateral edge of the crus of the helix. 57 is lower portion of the rectum at the helix, roughly parallel to the large intestine point. 58 is hemorrhoids point at the border of the helix, parallel to the uterus or prostate point. 59 is common cold point at the border of the helix, parallel to the hypertension point. Ear apex, apex of the helix of the ear. You can find this by gently folding the helix, sometimes called the urchion. 61 to 64 are helices 1 to 4. Next, we talk about the points. Let's locate the points of the antitragus and the intertragic notch area. Number 65 is Ding Chuan, height of antitragus, not on the anterior surface, but it is exactly on top of the antitragus, as you can see on the picture. Number 66 is the brain point. This is located at the posterior wall of the antitragus. This is the second point located on the posterior aspect of an ear part. If you remember, the first one was sympathetic, was a sympathetic point. 67 to 69 would be the occiput, temple, and forehead, inferior to the antitragus, run parallel to the antitragus on a curve. The most lateral is the occiput, temple is in the middle, forehead most medial. 70 is the brainstem point. This is located just above the antitragus area, intersection of the middle border of the spleen point with the curvature above the antitragus. 71 and 72 are the eye points, I1 and I2. I1 is located on the medial side of the intertragic notch, I2 lateral side of the intertragic notch. 73 is the raised blood pressure point below the intertragic notch between I1 and I2. 74, ovaries or testes, slightly superior to I2. Some locate the ovary point on the lower medial inferior portion of the antitragus. 75 is endocrine, the medial side of the intertragic notch superior to I1 on the posterior wall of the middle border of the intertragic notch. This is the third and final point that is not located on the anterior surface of the ear. So let's review. Number 65 is Ding Chuan. It is located at the height of the antitragus, but not on the anterior surface, but it is exactly on top of the antitragus. 66 is brain point or the subcortex, located at the posterior wall of the antitragus. So the subcortex is the second point located on the posterior aspect of an ear part. 67 to 69 would be the occiput, temple, and the forehead. 70 is brainstem, just above the antitragus area, intersection of the middle border of spleen point with curvature above the antitragus. I1 is number 71, the medial side of the intertragic notch. I2 is 72, lateral side of the intertragic notch. And in between is the raised blood pressure point, located below the intertragic notch between I1 and I2. 74 is ovaries or testis point, slightly superior to I2. Some locate the ovary point on the lower medial inferior portion of the antitragus. 75 is endocrine point, medial side of the intertragic notch, superior to I1, on the posterior wall of the middle border of the intertragic notch. This is the third and final point, not on the anterior surface of the ear. So first we have the sympathetic, next we have the brain or subcortex point, and the third and final point, which is not on the front surface of the ear, would be the endocrine point. Okay, let's review the past points that we have learned. So let's go to the points of the triangular fossa. These are the points that relate to nervous and hormonal regulation and pelvic organs. 1 is Shenmen. 2 is stop wheezing point. 3 is hypertension. 4 is sympathetic 1. 5 is sympathetic 2. 6 is sympathetic 3. 7 is uterus prostate point. 8 is constipation point. 9 is hepatitis point. And number 10 is the hip joint. Now let's go to the points of the head and face. The points of the lobe. 11 is upper teeth. This is slightly below the center of sector 1. Number 12 is the tongue. 13 is jaw, located at the center of sector 3. 14 is lower teeth, center of sector 4. 15 is eye point, center of sector 5. 16 is inner ear, center of sector 6. 17 is helix 5, lateral border of sector 6. 18 is tonsil. This is at the center of sector 8. And 19 is helix 6. So this is helix 5, 17. Helix 6 is 19. Number 20 is the insomnia point. This is slightly medial to the teeth points, 11 and 14. Then we have the thirst point, number 21. This is at the center of the superior portion of the tragus. 22 is external nose point, midway between the thirst and hunger points in the center of the tragus. 23 is hunger point. This is our favorite point for those who want to lose weight. Lower lobe of the tragus directly below the external nose point. 24 is internal nose point, midway between hunger and adrenal points on the lower portion of the tragus. 25 is adrenal, lower portion of the tragus close to its lateral border. Okay, let's go to the scaphoid fossa or the scapha. 26 is the wrist point. This is opposite the tubercle of the helix. 27 is finger. This is scapha in the uppermost portion. So you have to picture this area like the length of extended fingers. 28 is the allergy point, midway between the wrist and finger points. 29 is shoulder. This is level with the crus of the helix. Some texts will place this point at the level of the supratragic notch. Number 30 is elbow point. So this is midway between wrist and shoulder points. Then number 31 is the clavicle point. And our landmark here would be the height of the Antitragus. Some sources would place the clavicle point level with the notch above the Antitragus. 32 is shoulder point, midway between shoulder and clavicle points. 33 is thyroid, medial border of the scapha, parallel but slightly inferior to throat and teeth point. 34 is nephritis point, below the clavicle point at the end of the lateral border of the scapha. Okay, let's go now to the points of the cavum concha. 35 is the mouth. As you can see, it curves like a smile to parallel the lateral border of the external auditory meatus. 36 is heart, the deepest point of the cavum concha at the level of the center of the mouth point. Number 37 is the trachea point. Narrow horizontal area. It starts at the center of the mouth point and extends to the heart point. 38 is upper lung, depression above the heart point. 39 is lower lung point, the depression below the heart point. Number 40 is the esophagus point. Okay. We take the length of the distance from the upper curvature of the mouth point to the lateral end of the lower border of the crus of the helix. Then we divide this distance in half. The most medial half is the esophagus area. Then this one is the cardiac sphincter area, which is the half that is lateral to the esophagus area. Esophagus is the cardiac sphincter area. 42 is the stomach area. This is a round area that begins at the end of the crus of the helix, and it extends halfway across a distance formed by the end of the crus and the medial border of the lower antihelix crus. This is the lower antihelix crus. So that this is the whole area of the stomach. 43 is the liver. It comprises the second half. So this is stomach, this is liver. It comprises the second half of the distance from the stomach point to the middle border of the lower antihelix crus. And this area, as you can see, is triangular in shape. Then we have the hepatitis point, number 44. It is also found within the area found within the liver area, close to the lateral curvature of the stomach. 45 is relaxed muscle, also within the liver area. It lies in a roughly circular area below the superior border of the liver area. 46 is the spleen. As you can see, it's a large area. And then number 47 is Sanjiao, the deepest point of the cavum concha at the level of the intertragic notch. Then we go to the Simba concha, the points of the Simba concha. So we also have sectoral divisions of the shape of the cavum of the Simba concha. Number 48 is the duodenum point located in sector 1. Number 49 is small intestine point located in sector 2. 50 is large intestine point located in sector 3. And so number 51 would be at the junction of sectors 2 and 3 between the small intestine and the large intestine points. 52, this is the bladder area. Sector 4 directly above the large intestine point. Number 54 would be, number 53 would be the kidneys. The kidney, sector 5, directly above the large intestine point. 54 would be ureters, junction of the sectors 4 and 5 between the bladder and kidney points. Then number 55 would be the pancreas gallbladder. This is located on sector 6, directly above the duodenum point. Gallbladder point is located in the right ear, and the pancreas point is located in the left ear. Thank you very much. We hope to see you again on our next video.